Today I will talk about medicine and specifically two health disparities. I've always had a passion for medicine even as a little child, and it's only been pushed further through my experiences in soccer and in school. As a kid, when I was playing soccer, my friend, his name was Aaron, he had a really bad accident while we were playing, and his leg literally snapped in front of me, and you can feel. I held his leg, and you can literally feel the separation between his two legs. And in on that day, he was obviously taken to a hospital, and we didn't see him until after the game. And when we saw him, he still hadn't fixed his leg. He wasn't in surgery. He wasn't doing anything for his broken leg because his father thought that the healthcare out in Dallas, because that's where our game was, it was in he thought it wasn't the best in comparison to the medicine and doctors we have in California, which is most likely true because California attracts more of the highest achieving doctors that we have in this country. But to have him not have surgery or anything like that eventually hurt his son and made his leg actually even worse with an infection and inflammation and all of that. But it's not to say that it was his dad's fault. I think it's because of the fault in our healthcare system that has different levels of doctors in such a traumatic level because of the area of Dallas that we were in the area of Southern California that we're in. We had different quality of doctors that he was not accustomed to and didn't trust. I found this to be a huge health disparity in that we provide different quality of doctors to different areas in our country, which gives different areas a disadvantage to the quality of healthcare they are receiving rather than receiving good healthcare all around the country. Tend to give the more we tend to give the more wealthy people the better doctors just because they have more money, rather than spreading the quality of doctors based upon the amount of people in a certain area or the need necessarily for a better doctor in an area. But my passion was also furthered again when I was able to go on a med camp trip, which is in fact where I even got these scrubs in the first place. We were able to visit Johns Hopkins University, one of the most prestigious medical schools in the country, and Maryland University, which was working with the trauma center in Baltimore. And Baltimore, as everybody kind of knows, isn't the most wealthy area in the country. It's actually one of the most. It has a lot of conflict in there, and there's a lot of crime in there. And when I was around Johns Hopkins, I was surprised to see how many homeless people were there as well, and how much they were in need of treatment, or like they all seemed sick, and even right around the hospital, and they couldn't get the treatment they wanted, or any treatment at all. And I realized that even even the size of a hospital in Baltimore compared to the size of a hospital or quality of doctors the quality of doctors in Riverside, there was a huge discrepancy because most of the doctors that were at the Maryland hospital, they came out of either Maryland University or Johns Hopkins, which is home to better doctors, because obviously Johns Hopkins being a top 5 med school in the country, they are providing some of the best doctors, and they're only concentrated to certain areas in the country. Sometimes it might be right, but and other times we still need the better doctors provided in poor areas. But in all, we needed. I I believe that we can spread better healthcare around to so that there's an equal playing field for different areas of the country, for so that we can all get the same healthcare treatment and we can all get equal treatment, because I feel like more of the wealthy people are getting better treatment than some of the people without money, or who have little money, which when it comes to people's health, we shouldn't be messing around with it and basing it just upon money, because it's people's lives. So if we can save lives uh, by helping out those without money, we should do it. It's a no brainer in my head, because you're saving another person's life, and then they're gonna contribute back to the community because of them being alive in general. But I I feel like this is gonna be a long process, because even through the research I did and the work I did, I've realized that we're gonna fail at this a lot. We're not gonna be able to do this in a couple of years or a couple of terms in the presidency. This is gonna take a long time, because the healthcare system in place is not made to spread out equal treatment of healthcare around the country. But I felt like there also was a lot of success in this, that people are looking to have equal treatment, especially doctors. They're looking to have the same quality of doctors all around, and they want people to be able people to be able to go to doctors they're comfortable with, and not have to be uh, forcibly to forcibly led to doctors they aren't accustomed to, or they don't trust even. This health disparity that I'm trying to amend is not even solely upon the United States in specific areas in comparison to each other. It's as the United States as a whole. We are paying more money than most uh, technologically advanced countries like Japan, England, France. They all are paying less for their healthcare system than we are, and for each person having to pay more money for their healthcare, because the country as a whole is charging more for it, is uh, concerning to me, because the only price is going to be driven upward, and if it's already double what it is in other countries that are technologically advanced as we are, then we're just going to end up paying more and more. So to have the disparity as a country as a whole, that we're paying more than we should be already, is concerning to me, and I think that we should be able to cut the price in that, so more people are able to receive the healthcare they are desiring and trying to get in general. So in all, my dream and vision is to create a healthcare system that isn't solely reliant upon the amount of income one receives, and is based upon what the patient wants and how or who they want to be treated by.